So in stage 1 testicular cancer, we know this is highly curable. The current standard of care would be active surveillance, but some patients do undergo adjuvant chemotherapy, those patients with highest risk of recurrence. The problem is, even in those with highest risk of recurrence, the use of adjuvant chemotherapy leads to unnecessary treatment and toxicity in the majority of patients. So what we need are better biomarkers that can predict recurrence. And one of those biomarkers could be miR-371. So the climate study set about understanding if miR-371 can predict recurrence. And so we enrolled 200 patients from Australia and New Zealand across 12 sites, and we recruited them and they underwent active surveillance for stage 1 testicular cancer. They had blood tests looking for miR-371 at baseline and then every 3 months for the first couple of years. And today we reported our interim analysis. So these interim results looked at whether a baseline miR-371 could predict recurrence. We looked at the positive and negative predictive value and also compared a plasma versus serum assay. And what we found in this interim analysis was that plasma assay was superior to serum, and that yes, in fact, a miR-371 at baseline, just after orchiectomy, can predict for recurrence with a hazard ratio of 10.3, p-value highly significant, less than 0.001. What we found at 24 months was that recurrence-free rate in those who were positive was 32%, but in those who were negative was 89%. So it clearly stratifies for recurrence. And so what we hope in the next step is, can we design the studies that can demonstrate that those who are positive do need adjuvant chemotherapy?